it would be a bit strange you being a dental practitioner working in pajamas. But to be fair, if my dentist was in PJs, I'd be like, you know what? You're having a great time. You're a lot more comfortable. I respect the hustle for doing that.
Well, you could make a case that scrubs are almost PJs. I mean, a lot of dentists wear scrubs, and you wash those things a few thousand times, and they feel like a good pair of silk pajamas.
Wow, very, very insightful. I've never worn scrubs, but I went to the dentist last week actually, and I noticed scrub wearing. But we are here today. I'm here speaking with Dr. Blaine Leeds, who has been in the dental industry. You're a dentist and you have been for a few decades, but you've also recently turned your attention into sleep because there's a very interesting connection that a lot of people weren't aware of when it comes to sleep, and specifically sleep apnea and then jaw growth and all kinds of stuff. So a lot of what you're trying to kind of get out there in the world by doing your little podcast tour and also your book as well, that's I think either has just come out or is coming out. So rather than asking rhetorical questions, I'll ask you, Dr. Blaine, when is your book coming out? What's it about? And we'll jump off from there.
Well, thank you so much, Mike, for having me on. The book is called What Happens When Your Child Doesn't Sleep. It's written with my colleague, Bryan Ferre, Ferre, Bryan with a Y. And it's basically about, how underdeveloped jaws can cause our children not to be able to breathe properly and therefore not sleep very well. And it can lead to things like bedwetting and anxiety and attention deficit problems and this sort of thing. And so really what my, as you say, little podcast tour is about is, can we tell this story? What's the new story of dentistry, in the UK and the US in 2020 and beyond? And in the US, people still think I pull teeth every day. That's what how many teeth you pull this week, doc? Well, hopefully 0, because we're trying to save most of them. And dentistry, we've done, I think I can talk about us as a profession, right? Because I am one. It takes one to know one, the old phrase is. But, we've done we're getting better about it, but we've done a poor job of marketing actually what we do. And we didn't market anything at all for a long, long time. And it was considered out of vogue, to market yourself as a medical professional in the States in the 70s and 80s and even up into the late 90s. And then we've had some television programming over here that helped change that. Bill Dorfman, a dentist in Los Angeles, had a show on ABC television here in the States called Extreme Makeover. There may have been something similar that, a lot of UK shows come over to the States later on. So maybe it started in the UK. I don't know. And they made an American version of it. I'm not sure. But it certainly, everybody kind of ballyhooed that as unnecessary stuff in our profession at first. And then we were like, wait a minute, my patients are coming in and asking me about sleep apnea and asking me about, how they can have the same veneers as Catherine Zeta-Jones, which they can. And I provided those for my patients from the exact same lab, thanks to Bill Dorfman, and actually educating people about what our profession is. And in 2010 and beyond, I can't remember when the show began airing, but it was a real boon to us, as a profession, because people were able to understand that, hey, the dentist doesn't have to be scary. It can be exciting and fun and, cosmetically pleasing and aesthetic, and really help people smile better and feel better and sleep better. And with the sleep side of things, I learned late in my career, sadly, here in the States, we didn't teach it very well in the early 90s and mid 90s that, we can help patients feel better. We can treat a whole human being. We could even save someone's life in the dental chair.
Agreed. Yeah, it's mental. When I was looking up some of the information, because I think dentistry is something that, although it is integral to society working, like when you look into the depths of sort of pre-dentistry, I was looking up, like, dentistry as a formality kind of emerged in sort of the early 1700s in France, and then it kind of evolved from there. There's obviously been history prior to that where there have been individuals cleaning their teeth with a variety of things. I think chewing pine and stuff like that has been a case. But like even in the UK, dentistry wasn't really considered that majorly until the last sort of century or so, when the NHS kind of got formed and then dentistry got allowed into that. Then a lot more British individuals started taking more care of their teeth. I know stereotypically Britons do not have the most cosmetically pleasing teeth, according to all American TV shows, but especially the cartoons. But it's one of those where one thing I always say to people when it comes to teeth is, Obviously, it's very important, and if you get infections here, it's right next to your brain. So if something severe happens there, it can cause some serious problems. It's what you eat out of, it's what you breathe from, but also a parallel I like to draw is one of the biggest killers of dogs and cats, especially when they're stray, is mouth infections. Is their teeth start to rot and those sorts of things. And people with dogs and cats, I have a dog and I grew up with cats and things. We know how important it is. How much that can happen. But I think that in today, less so today, but kind of decades prior, people really didn't prioritize teeth health. So before delving into some of the things that you've kind of discovered, well, not you as an individual discovered, but some things that you're trying to shine a light on more so, is I want to ask, over your decades in the profession, have you found that more recent, like in the last 5-10 years, people have been more open to sort of taking on like flossing and things with teeth health? Has it got worse or better, or has it changed at all out of interest?
Oh, I think it's some of both. I think we'd be surprised how little it's still prioritized, in some geographic areas in the United States. But I would say, across the board, it's gotten much better over the years. In 1996, when I graduated from dental school here and from the University of Tennessee Health Science Center in Memphis, Tennessee, every month after that, it seems that there was a fabulous piece of technology. For example, last week, I was on LinkedIn looking at some different folks that were on there and communicating with some people, and I saw a brand new home toothbrush hygiene device called a Proclaim system. And you would think that we've had the toothbrush for centuries. In fact, I believe, going back, not to diss your longtime friends and adversaries, the French, across the channel there, but way back in ancient Egypt, we have evidence that the ancient Egyptians did root canals. They actually used gold points to fill the root canal space in teeth. There were gold crowns that were done on some of the pharaohs. So dentistry has been in some form, way back into the prehistoric times. But this Proclaim device is you would think we would redesign a toothbrush. It's like a fork. How the fork is very similar to the way it was, back in the dark ages, maybe more tines now than it had back then on the fork. But God bless the spork. Do they have sporks in the UK? I mean,
Yes.
It's awful, because all they do is destroy one's ability to eat pudding. I mean, it's like you cannot get the pudding or the mashed potatoes from the bottom of the container with the spork. You might as well use the handle of the spork. But this Proclaim device, we'd think we'd have a better toothbrush than just a handheld thing with bristles on it. But maybe it's the portability of it, the ease of just shoving it in a tiny little dop kit or bag to take with us has made it easy. But this system it fits like a whitening tray or a night guard in the patient's mouth, and it's connected to a hydration-driven system, a water pressure system, almost like the combination of a water pick system and a toothbrush, so that a patient, and in 7 seconds, it provides a home care hygiene experience that is 13 times more effective than flossing.
Wow.
And these are some pretty interesting studies. It's not, a fly-by-night organization that's done this. It's real peer-reviewed type studies. But so your listeners may want to check those out. I mean, because this system is coming, and I'm certainly interested as a provider. If my patients, because everything in life, we need it to be done faster now, right? So we can get back to our podcast or whatever we're going to do. So, it's in 7 seconds we can provide, because, I've been teaching my patients for years, we used to use timers. In fact, some of the Oral-B devices here in the States have a timer in the handheld portion of the brush, to remind patients, okay, well, you've brushed long enough in this particular fourth of your mouth, so it's time to switch. And so if we've got something that could clean someone's teeth at home in the time that I just took to describe this, the segmental polishing of an Oral-B device to you, then, we've come a long way. And those things continue to come out. I mean, root canals changed forever. The year that I graduated from dental school, everything became powered and rotary driven instead of using hand files for patients. And so these procedures, the only reason in the States now that we discuss root canals with patients is because we don't have the NHS. So patients have to private pay for everything. So we have to discuss cost. because root canals end up being one of the higher ticket items in a dental office if the doctor provides that service. And otherwise, our patients wouldn't know that we were doing them. I mean, literally, the procedure now is so smooth and so straightforward that, if someone's listening to this in the States and you have a painful, god-awful root canal situation, then there was probably some infection still there, or the nerve tissue is really inflamed. And there's a way around that. Dentistry in the UK or the US or India or wherever you have it, in 2023 and beyond ought to be comfortable and not a big deal for the patient.
Mm-hmm. Yeah, I personally have never had an issue with going to the dentist. I've been quite fortunate where I had teeth pulled, but that was like a milk teeth, so that wasn't too bad. Whereas, as I said, Megan, she had a wisdom tooth pulled out last week, which she was quite worried about it. So I went into the practice with her and sat while she had it kind of pulled out and things. And even from my memory from when I was younger, I was like, that was done in minutes. I remember it took ages of mine. I know there is also the, different teeth and then how far gone it is, and also teeth can shatter and all kinds of different elements of why. But even just from my own memory and seeing things, they've really changed in techniques and advances. I think X-ray, I know X-ray's been around for ages, but I went in for a checkup because I hadn't my last dentist appointment, I'm sorry, since before COVID. But my dental surgery, I had an appointment, COVID, lockdowns, they said only emergencies. And then I was like, okay, I'll give you some time, contact them in 2021. We didn't hear from you, took you off the list. So since then, I've been like, I need to find another surgery or another practice. And the lots have been full. So I finally found one, which is the one that Megan goes to. We had that done and they were like, just quickly get an X-ray. And I was like, I'll be in there for ages. And then just a little thing on the side of my mouth with a little plate on it, like flick, and then other side, and done. And then she showed me then and there, oh yeah, here's your teeth. And I was like, what magic is this? So the advances in technology, as you said, like they're going in such a cool direction. But something that you've mentioned in quite a few of the podcasts, which here I try not to tread old ground, but there's certain times where topics get spoken about where they're just too interesting. So I'm going to have to ask you to repeat yourself as you have done on many other podcasts. But the future of dentistry, you have mentioned with AI being a positive force for a lot of things to do with dentistry. So I wonder if you could touch on that a little bit of how you perceive the future of dental work going, and especially with the assistance of AI.
Well, I think I'll probably botch this term, but you've heard the term fractionation before. In other words, when glass fractures, it fractures in many different directions instead of just a straight line or sort of a crag line, in one direction. And that's where we are with AI right now. There's software rather from 3 weeks ago that is allowing AI to do things on Twitter or X now today that did not exist. Well, for example, my son's 32. On Friday evening, he spent about 5 hours and created a completely interactive piece of AI software where, using a Google Chrome extension, he was able to attach, that someone else created, by the way, open source, here, just grab this, use it, where you could actually speak to ChatGPT rather than type in the data. And from that, overnight, he was able to train the AI to actually speak to him using AI to do it. So he didn't have to code it or anything. So who knows where we're headed really in dentistry, but where we are in 2023 is there's great companies out there that are already using AI they've put the dental x-rays, digital x-rays like you had made at your local practice there. They've put thousands and thousands of those images into generative AI systems and said, this is what tooth decay looks like early on the x-ray. And so the AI has seen millions of these images. So now doctors will not have to look at the x-rays at some point because the AI will already say, hey, before you go in that room, doctor, you have decay on these 3 or 4 teeth. This is what you need to discuss. The patient's already aware of what kind of treatment options. And also patients are going to be able to go and get information from AI about the procedures they're going to have. And eventually, right, it's not 100% accurate right now. We know in ChatGPT, you better double check it because depending on what sources it looked to, the information could be completely false. But there are areas in dentistry and telehealth and teledentistry where, I can, if you opened your mouth and got really close to the camera right now, and we had a good light source, we could do a much more advanced than rudimentary dental exam for you, just, completely digitally like this. But we're going to be able to get to a point where, and that's one of the things I'm working on, is developing AI that is directed by me, so that I'm not going to be using, a joystick to control a robot in Baltimore to do a procedure, but I'm going to have already trained the AI to diagnose something, to explain to a patient the signs and symptoms of sleep apnea in a child, or even preliminarily have the information to see, once a patient uploads a photograph, for example, to see what their facial form is and what their jaw structure looks like, and be able to recommend an appliance for them that they can click and purchase right now, that I've already directed the AI to diagnose, if that makes sense. So that's really where we're headed.
Mm-hmm. Yeah, I mean, it's one of those with AI, because in my day job, I work in insurance, and they're talking about, how we can use AI for stuff. And a lot of some of my colleagues would be worried that, what about our jobs? And I was like, we're not there. That will be a conversation for the future. But really what AI is used for a lot of the time now is just trying to cut out the kind of, almost the admin work, the time in which any human almost could do. In loose terms, obviously when it comes to dentistry, it's a lot more complex, but in sort of terms, it's like, what's something that a trainee could know, a dental, a low-level dental nurse or an intern, the kind of things you'd learn on the job almost within the first few weeks, how to spot tooth rot, tooth decay, what to recommend with this or that, like these really sort of low-level things, in air quotes. That's the kind of thing that AI can do. When you get to the more complex things and the things you actually need a human for, people are going to want a human. I think for surgeries, I think it's going to be, even if it's possible, which I assume it will be at some point, almost everyone would rather, I think, have a human do it. Even though I imagine at a point, much like self-driving cars are going to get to the point, it's actually going to be safer to go with a machine than with an AI, but obviously than with a human, But that's a whole big kettle of fish, which is, we're not there yet. And you're not promoting a book on AI. You're promoting a book which you wrote with, it's Bryan, was it Ferre, Ferre?
Ferre, but he pronounces it Ferry, just
Ferre.
like the English musician.
Yeah. Okay, fantastic, brilliant. So, because I did read through the first 25 odd pages, I think, of the book itself, and I've heard you speaking about it quite a lot on things, and I do want to delve into that because, as I said, my fiancée Megan, she recently had a wisdom tooth out. She also suffers with sleep apnea. And I want to ask, because I think this question, I think you'll let it tangentially go into your book and things. But basically, what's up with wisdom teeth? Why is it that people so frequently need to have them removed? And then if you could kind of segue that into your book, then that'd be fantastic.
Sure. It won't be a very long segue. They're very much related, because there's a book by an anthropologist named Robert Corricini, and Dr. Corricini studied skulls in sub-Saharan Africa, where in that culture, many children breastfeed until almost age 4 or 5. Also, we see about a 5% chance or less of sleep apnea in adults in sub-Saharan Africa. Plus, he went back and looked at skulls from ancient times when our diets did not include soft, pureed baby food. Mm-hmm. Babies were given large raw vegetables or bones to gnaw on that they couldn't swallow. All right. So they wouldn't choke to death, but they could chew on the bones and get the nourishment out of, a hard carrot or a bone from an animal, back in the day. And so we found that functioning on the gums like that helps expand the jaws. And when we have expanded jaws, we have room for all 32 human teeth. And we're even seeing in our society 4 or 5 generations down the road that we're evolutionarily removing, by process of natural selection, wisdom teeth from human beings. Everybody should have 32 teeth. I was only born with 1 wisdom tooth. Typically in the U.S., about 25% of the population have 1, 0, 1, or 3. The other 50% have 2 or 4. Most people have 4 still, but we're even seeing people being born now without their wisdom teeth. But if our jaws are fully developed and fully expanded, and we know now that if we have about 41 millimeters, at least in England, you'll understand. Here in the U.S., it's only the U.S. and Burma, I believe, Myanmar, the only two countries that still use the English system of measure, right? But 41 millimeters between your upper first molars, or what we call the 6-year molars, the molars that come in behind the baby teeth when a child is 6 years old. The biggest portion of our biting, what we call the occlusal table, the way the teeth contact one another, these 6-year molars are the biggest part of our chewing surfaces. And those teeth, come in behind the baby teeth. If we have those teeth spread apart at least 41 millimeters, then we have a flat, broad palate. We have room for the tongue to rest up where it belongs behind the front teeth. And that keeps the tongue from falling back into the oropharynx, the airway space, and collapsing the tissues back there and making the airway small. And so those things are very closely related. We want big, wide smiles. Even space is good. In the US, we've been worried about space. Let's close all that space down. And what we don't think about is, if we look at a patient in profile, or we look at an X-ray profile of a patient, I could show you thousands of these where people have, an airway space the size of a coffee stirring straw, instead of, the size of a garden hose, or a little bit bigger than your index finger should be the size of our airway space. And humans should be breathing through our nose all the time, effortlessly, invisibly, quietly, all the time, because when we breathe through our nose, that's the only time that we hit a little sensor in the back of our oropharynx near the parasinuses, so that we secrete nitric oxide, which is what Vin Diesel puts in his Dodge Charger engine. And it's what makes us have a vasodilation in our body, so that we carry oxygenated blood to wherever it belongs and needs to be right now, whether it's our brain or our heart or our muscles if we're competing or functioning. And restorative sleep is so important in getting that oxygen where it belongs. And that happens with nasal breathing and big, wide smiles that have room for the wisdom teeth with the properly developed jaws.
Yeah, well, I have a nice big, I've got a gap right in the middle of those teeth, but these teeth at the bottom, there's no gap at all. And as my jaw has kind of shifted as I've gotten older, one of my teeth has pulled back a little bit, and annoyingly it's kind of caught. So I had this pain for a little while where almost a part of the tooth had kind of done that a little bit. So that was, I'm saying, yeah, proponent, the top teeth with the gaps and stuff, they've never had an issue. But I want to ask, we'll delve more into the point that you just made a little bit more in a moment. But one thing I've noticed from a lot of the podcasts and interviews and things I've been listening to you of is you clearly have a thirst for knowledge. Now, not just in dentistry and not just in sleep apnea, from obviously when you were diagnosed with it yourself, over a decade ago, but whenever you speak about anything, you always have got a footnote of other things that you find interesting. Obviously music is a very big part of your life as well. I think one of your sons is into music as well as in performing, and he's in a band, all kinds of stuff. And, you were just speaking about maybe the same son, maybe a different one, of doing the AI stuff. So clearly there's the knowledge kind of in there. I want to ask you on sort of a personal note, with the thirst for knowledge that you've had, how did you get into dentistry of all things? It's a very important profession, and we need people like you who are very open-minded and interested by it. But from a get-go, you wouldn't immediately think, oh yeah, dentistry, and then the thirst for knowledge that the universe holds. Just on a personal level, how did you get into dentistry, and maybe even why? Well,
and who, it's like do you get the old reruns of Rudolph the Red-Nosed Reindeer over there?
The stop-motion ones.
Who is that elf that says, I'll be a dentist? Who wakes up one morning and says to them, I'm going to be a dentist? And I always remind people, some people are grossed out by that. How do you look in people's mouths all day long? And well, at least I'm not a proctologist, is my comeback. There's a different end that might be more difficult to look at. But for me, I started thinking about, I loved the sciences as a little kid. Like in junior high, I kind of gravitated toward chemistry and biology, and my father was an engineer, and he always worked for someone else for the biggest part of his early career. And he was like, why don't you be a doctor or a dentist? Think about that maybe, because you can be your own boss. you can live where you want to live. And, my parents and I kind of talked about the quality of life, things that happen, not with envy, but with longing, maybe from his own profession, where, he's obviously an intelligent guy. He has an engineering degree, right? So he could have just as easily gone into the medical sciences and maybe had a different career with, where he could do some different things with his free time and stuff. But so that was part of the encouragement. And I was good at the sciences. I liked sports growing up, and so I was competitive. And my mother was a very competitive person. She had two brothers who cheated her at Monopoly and cards, so she had to really learn how to count cards. And so she became a really good bridge player, and every other card game, Pinochle and Texas Pitch and Rook and Rummy, and she can play anything because she had these two brothers that she had to be watching them all the time. Did they have the Monopoly board game in the UK?
Yeah, we've got, I was playing it the other week, in actual fact, but we've got it for like every city you go to now in a gift shop. There's the city or town gift shop. Megan's got one of the university she went to, just the university. I play it, and where Mayfair normally is just the middle campus area of the University of Kent. And I'm like, I don't know it. I've never been here. This means nothing to me. What a niche Monopoly board.
I don't know if I want any of these properties. I don't know where they're done. But in the U.S., my mom, she had all of the mortgage. I don't know if people even know this. I'm going to go way off into Neverland here, but in Monopoly, because some people may have played the game before and never actually mortgaged the properties. In other words, when you own a hotel or a house and you have issues in the game and you're losing money, you can actually flip the cards over and mortgage your property and borrow against your real estate in Monopoly to get enough money back to actually get back in the game. And so my mom, she knew the mortgage values. She memorized all of the property values with one house, two houses, three houses, a hotel. So because her brothers would cheat her if she didn't know, they would pay her less rent than they owed. And so I came from a competitive family. So I was in school, I was competing, right? I was trying to maybe have good grades in science and try to be a top 5 guy in my class, that kind of thing. And so that with that background and really absorbing a lot of the science stuff and being fairly good at it, then that kind of drove me into that, spot in the world as far as getting, education in pre-medicine and pre-dentistry and going on to dental school. And you see a lot of family, connections in dentistry. A lot of people, their father's an orthodontist, so they get interested, or it really happens a lot in orthodontics. You'll have a patient that, she had a crush on her orthodontist, right? She went and thought, I love this job. I want to do this. And so a lot of patients end up being dentists that had a lot of dentistry done if they had a good experience. And so, but for me, it was I grew up in a small town in the rural American South. So I was able my dad had just enough money, as an engineer. We were poor, but we thought we were middle class kind of thing growing up. So we would travel to, Kansas City or Detroit or Chicago, or visit family in the summer and, maybe go to an amusement park or something. And so I saw enough U.S. metropolitan areas to know that I wanted to live in a small town and have a family someday and live, but I wanted to be able to go and visit these places. And so a career in healthcare enabled me to come back to the place that I loved, which was my hometown, and which I did for the first 16 years of my career.
That's amazing. I mean, my dad always said to me, he wanted me to be a dentist. He was like, if there's any job, because even here in the UK, we've got, generally the way they kind of work now is there are certain dental practices that are purely private, but a huge amount of them are both. So you basically, the NHS has got a certain waiting list, and then private's got a separate waiting list, normally shorter, but it costs more money. If you get fillings, you can get the horrible looking metallic filling, and that's on the NHS, so it's like at the moment about £40, or you can get a very nice like white one that no one else can see, that's of higher quality, but that's 250 odd pounds instead. So it's like if you've got the money, you can go private, but NHS still costs a little bit. And my dad always said to me, be a dentist. Our family dentist, he literally worked, I think, 6 months a year of that in the waiting room. There's no magazines. It was just one folder that's just our dentist across the entire world, like my month in China, and it's just in every place you've ever wanted to go. And Dad was like, you need to be a dentist. So, which I failed.
Well, and I will tell you that my dad, as an engineer, sometimes he had equipment that he designed that might be in the a small Texas town outside Dallas where it's 111 degrees in the summer, and he's hanging upside down on a machine trying to get a hydraulic cylinder to work properly. And so that did enter his mind. A dentist works with, pretty hygienists in a nice office every day. It's not like swinging an axe, sonny boy. Maybe you want to try this healthcare thing.
That's a good shout. I want to ask as well, I have a note here which is collaboration between practitioners and industries. And I've noticed that a lot of your work, even obviously the book being written with Bryan Ferre, where you wrote this book, that was a collaboration. A lot of the work you've done over the years, you've mentioned about speaking with other individuals. And you came from a very competitive family. And I know that in many industries, but I think in America, more so than other places in the world, competition is perceived as a good thing. Now, competition, I think, is generally a good thing. When you're growing up, it's very good to have adversity. Companies, they shouldn't have a monopoly, ironically. There should always be competition. But I think in the medical profession, I've not personally, and I'm not in the medical profession, so my knowledge is limited, I've not really heard about collaboration that much apart from stuff that is necessary. I have to collaborate with you because this patient's got this issue that is not my speciality. But with yourself, you seem to be collaborating with a lot of people in a non-mandatory way without having to. You're opening doors and wanting to collaborate. And coming from a competitive background, that's somewhat surprising. So I wonder if you could talk a little bit about the sort of your collaborative nature when it comes to dental work, and then we can delve a bit more into the book.
Sure. Well, I wish I knew the origin of this quote, but we'll call it anonymous for now. But I heard this quote that was great. If you want to go fast, go alone. But if you want to go far, go together, somebody said. And, we can help a lot more patients if we kind of band together and, have this collegial approach. Because I learned, and in fact, I learned to be less competitive with my colleagues in dentistry and have a more partnering approach from a Pakistani-born Canadian dental assistant named Imtiaz Manji, who retired way before I did as one of the founders of a group called Experdent, where he trained dental office personnel and dental assistants in Toronto, Canada, where he immigrated to back in the 80s. And Imtiaz eventually formed one of the largest dental education groups in the United States called Spear Education, and they're in Scottsdale, Arizona. But Imtiaz has retired now, but he's one of my mentors because he explained to me that you don't have to have 9,000 active patient charts in your dental practice in the U.S. to be amply successful. You only need 1,000 to 1,500 active patients. Well, I was in a town of 10,000 people in a county of 25,000. There were only 7 dentists. I was the youngest. I was the only one under age 50. And so that instantly freed me up. I was like, oh, wow. Okay. So I don't have to go out there and be, battling for that consumer dollar all the time. We just have to reach out to a few patients, take care of them, and let them invite others into our world and see how we're doing things. And, do like Steve Jobs said to do, and be different, think different, do it a little bit different. And for example, we had digital x-ray, which you just, talked about, having an image taken and instantly looking at a screen. I can remember in 1996, we were maybe one of the first offices in Arkansas in the U.S. to have digital x-ray with my colleague and partner back then, Dr. Steve Fisher. And Steve loved technology. And so, and he looked at it almost like a new toy. And so every month we would have a new piece of equipment that made things nicer for us or nicer for the patients. And digital x-ray, when you have a patient come in and you put that x-ray up on a screen that's 40 inches diagonal, and they can actually see what you're talking about, it changes. We didn't have to try to justify, what our price was for a filling or something, because our patients could look around and they could see that this is a different environment than we have in most places in Arkansas. This is really interesting and good care that I'm getting here, and we're grateful for it.
Very nicely said. I do think as well, linking with one of the earlier points we made very early on in this conversation, is another thing about dentistry I think a lot of people forget about is even if you ignore everything we've mentioned about how important it is, one thing is for certain, and that is your nerve endings in your mouth are arguably, them and I think your hands are like the most sensitive things. And like if anyone gets like an abscess in their tooth or a cracked tooth or needs a root canal, people can't function with the agony of toothache. Like it's even like I've had sinusitis once or twice from like a bit of a chest infection, and it spreads, of course. Went to the dentist just straight away, looked at my teeth, said it was fine, and I was just like, I've got so much pain here. And I found out sinusitis pressure and just took got some antibiotics and stuff. But like there's the pain, and I think that's something that really puts people off dentistry. Is why I think a lot of people are put off by hospitals in certain ways. There's other reasons, but like for me, I've always been, I have pain or discomfort. I go here and it gets fixed. But I think what a lot of other people do is they associate the place that fixes it as the cause almost. Do you find that maybe that they kind of inadvertently associate pain, even though it's actually meant to be the curing of it?
Well, it couldn't be that we actually did inflict some pain in our profession over the years now, could it? I mean, a few bad apples spoil the bunch, right? If somebody... back in the day in the U.S., we would use a root canal as the worst possible thing, analogy to compare anything to. In other words, I'd rather have a root canal than have that done. And now that you don't really hear people say that much anymore because root canals are such a non-event now that the technology is better and the medicine's better. And so, we brought a lot of that on ourselves, because we had, in our profession, we went ahead and worked on a patient when their nerve supply in their tooth was full of bacteria, and we wanted to get them taken care of that day. And we thought maybe we could by going ahead and working on that tooth today, when really they just probably needed to slow play it a little bit and have some medicine and come back with that. Because it's like if you hit your thumb with a hammer, you're probably going to lose that thumbnail. And so it's like, do I want to take it off today while it's twice the normal size and every nerve ending in that thumb tip is inflamed and sore? Or do I want to let it heal for a few days and then address the problem? And when there's vast inflammation in the nerve supply, it's like walking on your eyeball. I mean, it's extremely uncomfortable. And people have, I've had patients tell me that, nothing has hurt in my life like this. And a molar toothache, a molar pulpitis, inflamed nerve tissue in a human molar tooth is extremely excruciating. It's awful.
Agreed completely. So we'll delve into then your book itself. Now, the book, from what I understand, and please elaborate on this, is it seems to be that you were diagnosed with sleep apnea, and then you started delving more into the world of it while obviously keeping up your dental practice and things. And then you essentially have these two problems, which is children essentially having not a very high quality of sleep, causing a variety of different issues, and your own sleep apnea. And then as I think this book really marries what you found from those two things put together. So please tell us really, how teeth and sleep apnea and why children are involved, like all these things, they all seem to be not involved, but you've in the book and what you've been speaking about in podcasts, you've created the web to really show that these things are far more interconnected than people realize. So please delve in.
Well, that's really what the mission is to come on your podcast and others like it, or on a television interview or a radio interview, or through the audio segment of the book, or putting the book in someone's hands, or talking to doctors and teams in their offices, or teaching groups of people at a dental meeting. It's, hey, folks, we have to understand this story. And, I was at the American Academy of Dental Sleep Medicine meeting in Philadelphia back in May of 2023. And I was really shocked and appalled at how little the medical community and the U.S. dental community communicated with one another about this problem, and how unaware each side was of what treatment modalities were out there. And so, and Bryan and I have been trying to tell this story for a long time, because Bryan's story is much more tragic than mine. His wife actually passed away from sleep apnea complications 8 years ago now, and she had 2 CPAP machines wrapped in the cellophane and the plastic in the box underneath her bed when she died. And, when you lose a loved one like that, Bryan his background is in marketing and teaching people how to market things and sell things and build websites and train teams on how to sell and do marketing. And so he was like, I have to make this my life's mission. We can't have other people dying because of a mistake or dying because of ignorance, because they just don't know what their diagnosis really is. And we have to be really careful as in dentistry and medicine to not just treat signs and symptoms of a problem, but also look at what is the root cause of this. Why did Bob come in here and he's 53 years old? He's 100 pounds overweight. He's got dark circles under his eyes. He's grinding his teeth flat. His tongue is huge and has wavy scallops on either side of it. And all of a sudden he's on blood pressure medicine, and we checked his medical history and he wasn't last time. So his doctor told him he has congenital hypertension, congenital blood. It's probably just genetic. You just got everybody in your family's had high blood pressure. Well, guess what? Everybody in his family was also built like him. Their skull was shaped the same. Their jaws were narrow and they couldn't breathe through their nose. So along with the beta blocker to get the blood pressure down, let's look and see what really caused it. And let's see if maybe he could have orthodontics as an adult, standard orthodontics, bands and brackets and wires, and move teeth around and create some expansion and breathe better through his nose. Let's address what the root problem is. So that's what we're really trying to do is, and as a patient, a CPAP patient myself, a sleep apnea patient, I was one of the few people who could, only 4 in 10 Americans are able to tolerate a CPAP machine. We're just wearing the device.
Megan hates it. So, she's got the mask thing like that, and she can't stand it.
Yeah. Well, it does her mask. We'll do a little bit of diagnostics with her not even there. Does her mask cover her entire nose and mouth?
Yes, and I've heard you saying that you think the ones that go in the nose have got, well, not you think, the data shows that the ones that just go in the nose work far better, don't they?
They should, yes. And I think that's part of the reason that we have such a low compliance rate in the U.S. is because some doctors don't understand that they shouldn't prescribe this full face mask for a couple of reasons. Number one, some people are claustrophobic. They cannot tolerate that. It's just covering too much of their face. Number two, it's terrible for the skin. They're breathing in and out through their mouth, and their skin gets flaky and dry, and they hate that. But what happens when we put the nasal pillow attachment on, so that's the most comfortable one out there, everybody. If you got to have CPAP, I don't know why my Zoom has some sort of setting that that celebrates when I lift my hands. Let me do some jazz hands. So that
was perfect timing, though. I loved that.
Fireworks right at the proper moment. But I love the nasal pillow attachment. And I was fortunate that I had the nurses in the sleep center where I had my sleep study done. They said, oh, yeah, you want this attachment. It's the most comfortable. And I went home, Mike, and I put this thing on, and I slept 4.5 hours. It felt like I'd been asleep for a month. I mean, I woke up feeling so much better, and I had no idea I was sleep deprived. And I was always one of these people who felt like he could survive on 5-6 hours of sleep. Every human being needs 8 hours of sleep every night. And a person should be able to sleep throughout the night without having to get up and whiz. So if you're having to get up and pee in the middle of the night, look at, sometimes that can be your body's defense system flushing your kidneys and waking you up because you're not breathing. So look at things like don't consume caffeine after lunchtime. Caffeine stays in our system 6 hours after we consume it. So in England, if we're having high tea at 4 o'clock in the afternoon, then, maybe you should go to bed at midnight, British time, because that way maybe the caffeine will be out of your system from the tea. So monitor that kind of stuff, because human beings should be able to sleep throughout the night. So I had the CPAP machine, and then I thought, oh, wow, I can actually help patients with this. So I started taking better medical histories. We started having our hygienist do blood pressure readings at a dental office, which is just a really nice service anyway. In the U.S., the way dental insurance works is they'll typically pay for hygiene visits, teeth cleanings and routine exams twice a year at 100% coverage. And so in the U.S., you're seeing your dentist twice a year if you have insurance. And so as dentists and dental teams, we can notice changes on a really nice increment in our patients. Oh, you've lost 40 pounds. Congratulations. What happened? Oh, well, I had cancer. I've been sick. Oh, God. And so you find these things out. But, as a practitioner, we take a good medical history, we gather some data, and we start treating the whole person, because we're seeing these patients twice a year. It's such a nice service. if we can also save their lives. I mean, the Panorex x-rays that we take, I'm sure they take them at the NHS over there. Many times we can even see the carotid arteries. I bought a practice here in the States that did not have a Panorex machine. We put a fairly inexpensive digital Panorex in the office. I think it cost $12,000 in 2011 for this device. We saved a person's life the same afternoon we installed it because they had carotid blockages. They'd been coming there to the dentist for years, never had this x-ray before because it wasn't offered. They had double blockages the size of my index finger in their carotid arteries, which showed up on a standard dental x-ray.
Oh, wow.
So sometimes these routine exams, if you're alert and you're aware as a practitioner and you're trying to help your patients, you're treating the whole patient instead of just looking at that tiny little groove where that tooth decay might be, these kind of things can happen. And so as we started to be more thorough and complete and treat the whole patient, we realized, oh my goodness, these kids aren't breathing. And these large tonsils are caused from 20 hours a day of mouth breathing. That's why children have tonsillitis many times. They're breathing this unfiltered, bacteria-filled, cruddy air into their oral cavity with no hair in their nose to filter it, no distance from the nose to the base of the face to warm the air to temperature. So it's this stark, cold air filled with crud that's coming into their mouth because they should be breathing through their nose, and we have inflamed tonsils and adenoids. So that led to, how can we help these children? What can we do? And we know now that there's a multiplicity of appliances out there that we can have children as young as 2 begin to wear, and it helps them while they're sleeping. It helps them expand their jaws and keep their jaws from being underdeveloped so they can breathe through their nose, which is the key.
It's amazing, yeah, because a lot of I found so much information out listening to some of the other talks you've been doing. I think it was approximately 80% of skull development has occurred in the first sort of 2 years of life, where your skull is going to grow to. 80% in the first couple of years. And I know that you've used anecdotes before where it's been oh, yeah, the kid's teeth aren't great, but we'll wait and see, and we can just do orthopedic surgery or orthopedic sort of action on them at a later date. And you yourself have said, we need to do it earlier. We need to correct these things sooner and sooner because, all of these things that are occurring. And I think, reading between the lines in some degree, I think that what's happening with society, and it's same with AI, same with social media, all that jazz, is that everything is advancing quicker than we have time to almost evolve to catch up with. Now, I know that that's not how evolution works, but it's something that changes in society. Either our diets are changing, or the air that we're breathing in, or any kind of variety of things. You mentioned about less people are breastfeeding for a variety of different reasons, but because of that, it's, the chewing motion on the breast that essentially helps the jaw develop in a proper way. All these different elements of things that are contributory factors into why these things are happening. And it seems like everything's moving forward so quickly, and no one's looking at really simple, or not even simple solutions, but things people hadn't really considered. And I think with dentistry, as you kind of said earlier on, is marketing people for dentistry hasn't been ideal, but also, as you say, the toothbrush has been around for, potentially thousands of years. And it's the toothbrush I use, I've got an electric one, but the one I use when I travel and stuff is just a standard one. It's basically the same as the one I used when I was a child. And it's how is the technology of all these other things changing so much? And technology within the dental practice is changing as well. But why is it not other elements aren't catching up? Why are things not getting better at the rate in which technology is improving in certain respects? And I think what you've honed in on here is just, it's something people are overthinking in a way, but you have to have all of the bits of the picture. You need the whole of the medical professions to all be here's the data we found here. Here's the data we found here. And once you all get that, it's like a jigsaw puzzle. And I think that with the work that you're doing, with this book and the podcast tour and any other places that you speak on this, I think that hopefully not only will it foster, what you're aiming for, which is, to reduce sleep apnea in people, and then also to improve, dental health and etc. But I'm hoping that this will be a template for more medical industries, including dentistry more so, to collaborate, because it's so surprising. I'm so thankful that you exist and that you've spent all this time and effort, and you and Bryan Ferre have done these things to push these things forward. But the fact that there's other individuals involved, but it's not common practice, how more people don't know this yet, is quite scary in certain ways.
Well, and I've been focusing on this, Brian and I have, since 2017. And then I went to this national meeting, and there were, I mean, one of the speakers there was from Scotland, one was from Iceland. It's a global meeting, really, of the finest minds that we have dedicated to this from a dental perspective. And then I got there, and and what I left with was feeling nobody still understands this. Nobody knows about this yet. Nobody in the world out there understands this still. And we have a huge, and so I went straight to Bryan back this summer and said, we got to write this book. We've got to figure out a way to tell this story, because there are colleagues of mine out there who are treating these children every day with the right treatment modalities and really changing people's lives. Like my buddy Ben Morale in Mount Kisco, New York, and Callie Hale in Texas, and Kevin Goles in Colorado, and my colleagues in California, all over the country, that are helping kids in the U.S. by just having them wear simple appliances and learn how to breathe through their nose and sleep with an appliance in that helps them breathe through their nose.
It's incredible. And there's other little things like, we could spend hours talking on this podcast about all the incredible, interesting things that you've spoken about, but we will start to wrap up here. But I want to mention as well, like you've mentioned in the past, these are just like footnotes. I just want to say to people, check out other podcasts you've done as well, because I didn't want to tackle every single thing. But like the main cause of insomnia is people often too hot. The ideal temperature needs to be 67 degrees Fahrenheit or 19.4 centigrade, or lower. A lot of the time I think people need to get cooler when they kind of go to sleep as well. And that's a little thing that you would hope that with the sleep epidemic, or the almost insomnia epidemic that this world is having with social media and blue light and all that jazz, you'd think that that's a real, surely you'd think, okay, every room in the Western world should have a thermometer in it so we know to get to that temperature. I found that out today, and I've listened to Matthew Walker, who I know you've cited before, who's obviously a frontier in a lot of the sleep research. I've listened to podcasts with him, and I know there's a lot more other stuff I can consume to find out more, but I only found that out like today. And there's lots of little things which are just like, there's so many bits and pieces that people just don't know about yet. And what you're pushing forward is really revolutionary. And, with my partner, as I said, she has, or fiance, I'm so used to saying partner, we've only been engaged for 6 months now, but it's like,
congratulations.
Thank you very much. It's one of those where it's just, with sleep apnea, when she didn't even know about it, I diagnosed her. I could hear her sleeping and like waking herself up from the choking on the throat. And I was like,
and for me, my wife diagnosed me. My wife saved my life because she said, and she's a very heavy sleeper. We live in Tornado Alley over here in part of the time in Western Arkansas, Eastern Oklahoma. And so, these tornadoes blow through, and they rank them on this Fuji scale, right? And my wife I always say she could sleep through an F5 tornado, but she could hear me stopping breathing. She could hear me snoring or gasping for air after I would stop breathing. And that's what patients do. Apnea means literally without air. So patients will stop breathing completely. And when we look at a patient's and sleep studies are so easy now. We can do these in the US where you just wear a ring on your finger. It interacts with the smartphone. You get great data overnight. But it's estimated in the US that 64 million Americans have undiagnosed sleep apnea or sleep disordered breathing.
It's about a fifth, isn't it, thereabouts? It's about 330 odd million people.
Yeah. And so, 300 odd million, 360 million. So 20% of the US, having some sort of an issue with it. And it's just so important. But with the sleep study, we can determine that these patients they're stopping breathing for 60 seconds, 70 seconds. And then guess what? There's a corresponding cardiac response where the heart rate just escalates. And when do most heart attacks happen, Mike?
At
night. And so they're very, very intertwined. So everybody get your partner to listen to you breathe a little bit if you fall asleep first, and see if maybe a sleep study might be in order. I'm interested. Sometime we'll have to come back on and talk more about sleep apnea with the NHS and how, because you have in your country, you have doctors and dentists all many of them working for the NHS. And so they should be able to communicate back and forth about this. Whereas in my world, I can't diagnose sleep apnea in the United States if a patient wants it covered by insurance. So I have to have a medical colleague that I can say, hey, I've got some data over here. It looks like sleep apnea to me. Can you please confirm this diagnosis and see this patient? And then once they do, can they make them an oral appliance? No, because they're not a dentist. So we have this. That's another disconnect that I want to talk about and have people understand is that, and really the number one thing is going back to this temperature setting and caffeine after a certain time. Mike and Blaine and all the, your fiance, my wife, we're all in charge of our own health, right? And it's ultimately our responsibility to make sure that doctor didn't give us both a stool softener and something to make us go to the bathroom, right? Or something to make us stop using the restroom. Because I can't tell you how many patients in my career I've seen that have been on both those medicines at the same time. Read the labels, read what's in your food, eat good whole foods and drink tons of water. I mean, hydration is so important. I can't tell you how many patients I see every day in my dental practice that aren't drinking enough water. I mean, just there you go. We should have 16, 20 ounces within reach at any given time, wherever we are, because I think our bodies are 76% water by mass, something like that. It's very important. And so just simple things like that. Simple, but it's not easy, right? We stick with it but be responsible for your own health. And then from that standpoint, we go back to one of my favorite Englishmen of all time, John Winston Lennon, and then it's just whatever gets you through the night is all right, right?
That's absolutely perfect. We will wrap up. I'll give you one more. I'll pass the mic back to you for one final comment. But I want to say again, thank you for all the work you've done. You're more than welcome to join back again for a part 2 and to talk about some other things to do with, I
want to come back and talk about how bad Darth Vader's sleep apnea is. I mean, Mike also has a Star Wars bucket. So it's like, this guy never breathes through his nose, right? He's always breathing.
I've got a tattoo of Darth Vader actually, so it's one of those. I'll show you once we're done recording, but it's nowhere weird. People on the podcast will see it plenty of times. It makes it sound like it was on my bum, but it's not. Trust me, that's not why I'm not showing you on the pod.
Darth Vader I've had him replace one of my nipples. Yes, that's
Darth Areola.
There you go. That's right. The Sith Lord nobody needs. That's right.
But yeah, it's been delightful chatting with you, Blaine, and I love listening to you on other podcasts and hearing the passion you have, not just for dentistry, which is your profession, and the intrigue into sleep, in which we're helping sort of push forward as well, but also like your love of music, and all kinds of other things as well. So there's always plenty to speak with yourself. I want to throw in another little thing that you mentioned in prior, which was in another pod, which was children bedwetting. What you've noticed is treating sleep apnea can help bedwetting, because if your body is suddenly like can't breathe and it can't wake you up, what's the response? Flush and try and get something to shake you awake because you're running out of air. So it's another little thing of like, there's so many layers and so many treatments that must be given to kids that actually you're treating the symptom rather than the cause. So again, thank you for all of those things. And is there a last final thing that you want to say to anyone? I'll include all the stuff you've discussed in the description as well as links and everything. But the floor is yours, good sir, before we wrap up. Last things.
Just think more about your sleep. And, if your sleep is not restorative, go get a sleep study. Go to the NHS if you're in the UK and say, I was listening to this crazy podcast with Mike Burton, and some Yank was on there talking about people not being able to sleep. And I think I may have some of these signs and symptoms. And if you have them, ask your partner if you're having trouble breathing at night. Do they hear you making strange sounds? If you've got dark circles under your eyes, you breathe through your mouth a lot, you have headaches a lot, don't have restful sleep. My question to my patients most of the time in the practice was, how do you sleep? When's the last time you felt like you got a really good night's sleep? And if they can't remember, then you start looking for the other signs. Grinding your teeth, another sign. Mouth breathing. Drooling in children, bedwetting, all can be related to sleep apnea. So before we go out and we put our children on heavy stimulant medication to help them pay attention, let's rule out sleep apnea first. Adults, you're never going to feel good. You're never going to lose weight. If your sleep is not in order, if you don't have restorative sleep. So, get that in order. Take a real hard look at how well you're sleeping and how well you're resting.
That's it. The dentist tells you to sleep. that's when you know it's important. But once again, thank you so much for your time, Blaine. I really, really appreciate it. And there we go. And that's the end of the conversation. Thank you so much for tuning in. As always, my friends, make sure you check out the details in the show notes, including Dr. Leeds' website, and look out for his book, What Happens When Our Children Don't Sleep. If you want to hear more conversations like this, make sure you check out the back catalogue, as I've been doing this for many, many years now, so there are lots of conversations surrounding science and that kind of thing. A great place to start is Science But Simple. It's a mini-series I did for the first couple of years of podcasting with my friend Josh. You can go into any podcast app and type that in, or you can go to youtube.com/genuine Chit-Chat and go to the Science But Simple playlist to hear it. But what else have we got coming up? Well, I obviously recorded a conversation with Ethan Sachs, the Star Wars author, a couple weeks back, and I've released that. And then next week is going to be another conversation with the Star Wars author. This time it's Adam Christopher. He's the author of the book Shadow of the Sith, and he's also written short stories in each of the Certain Point of View books as well. We also talk about Star Wars and other sci-fi-y things like Doctor Who and that kind of thing, so a really fun nerdy conversation coming next week. Then after that, we've got another Clone Wars conversation prequel where myself, Megan, Dave and Maff all watched the Clone Wars movie, and we're not overly a fan of that film, so it's going to be a really fun conversation there. Then we've also got there's going to be a Buffy podcast before Christmas, there's going to be another Disney Discussions number 10, and if you're listening to this on the day of release, you've got like 2 days to send in one of your Disney films, and then myself, Rhea, Dan and Megan are each going to choose one of those movies, and then we're going to put it out to a public vote, and the top 2 we're going to tackle in Disney Discussions number 10. And then there's a couple of other things in the background. In the new year, I'm going to be speaking with Goff, and there's a few other cool things in the pipeline, but that's generally what's going to happen in the immediate future. If you want to follow me on social media, you can at Genuine Chit-Chat on Instagram, X, Facebook, and TikTok. I'm also on Threads now as well, which is obviously connected to Instagram. In addition to that, if you want to help out the show, you can share on social media, you can tell your friends, you can leave a review on Apple Podcasts or Good Pods or Audible, or you can leave a rating on Spotify. If you do any of those things, send a screenshot of it my way and I'll send you a bonus episode, which is on my Patreon. Speaking of which, if you go to patreon.com/genuine Chit-Chat, if you donate as little as £1 a month, you get immediate access to over 190 episodes of Afterthoughts. I think it might be on like 200 now, when primarily myself and Megan release like bonus episodes every single week. So we review TV shows and movies and live performances we've seen, and sometimes there's extra long episodes where we go on road trips and stuff. If you've been a listener of the show for a long time, you'll see occasionally those kind of things pop up on the main feed, but on the Patreon, there's a huge amount of them, and the vast majority of them you cannot get anywhere else, and it's just another podcast to add to your weekly roster, but the majority of these episodes are between 10 and 20 minutes long, so they're nice and bite-sized. So if you want to support the show, currently I'm saving up for a new video camera, so if you're watching this on YouTube, thank you so much, but if you want to support the show and help me afford a new video camera that's a bit higher quality, then please consider subscribing to my Patreon, or go over to ko-fi.com/genuine Chit-Chat, and if you give a one-off donation of even £1, I will still send you a couple episodes of Afterthoughts. But that's going to be enough from me. Thank you so much for tuning in. As always, my friends, I will talk to you next week with either the Adam Christopher conversation or Clone Wars conversations. I think it's going to be the Adam Christopher chat because I've got that recorded and I'm very, very excited to release that. But make sure you subscribe if you haven't already, share the show, and do all those usual things. I hope you have a wonderful time, and I'll speak to you then.
You have just experienced host, creator, everything elser of Genuine Chit-Chat, and also the host and creator of Star Wars Comics and Canon, found on the Comics in Motion podcast, Mike Burton.